Good night, everybody. Welcome to the Tuesday, December 21st Board of Selectmen meeting. We'll start with the Pledge of Allegiance. Would you lead us, Chief Kelleher?
Certainly. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so I don't see anybody here for citizens input. Christina, anything come in?
No.
Okay, so we'll go to number 2. Okay, so application for 2 one-day beer and wine license for Cholitos Taqueria.
She was coming in by Zoom, but I don't see her on just yet.
Okay.
Can we talk about
I'll
it
reach
before
out to Margaret and just remind her. Maybe she's having some trouble.
Okay,
Sure.
thanks, Katie.
Okay.
Yeah, if you want to queue it up, and then between Katie and I, while Margaret gets on, we can answer any questions if you'd like.
Sure. Okay, so I took a peek. The only thing that I saw was, I think, whether it was just an error on both of them. They say that the inventory is going to come in on January 2nd. So I know they have to, the stuff can't be, we know just from the beer garden, which we learned that the inventory cannot be kept on premises. It has to come in that day and leave that day. So on both
Right. So
licenses,
apologies, Stephanie. That was my error. For the January 2nd date, it will be coming in that morning of January 2nd. But for the December 26th date, it will not be on premise until the morning of December 26th. So that was my fault.
okay. So January 2nd is, so they're both coming in the day of?
Yes, that's correct.
Okay.
And we do have Margaret on right now.
Oh, good.
Sorry, I couldn't get in previously.
No worries. Hi, Margaret.
Hello, how are you guys?
Good.
Good, thank you.
So we see you wanna get a 2 one-day licenses.
Correct.
So I guess I'll just start. I had a couple of quick questions. Do you serve beer and wine or alcohol at any of your other locations?
We do not.
Okay. All right. So first of all, just want to say love your establishment. We go there often. So the only thing I was thinking is just like when I walk in there, I feel like you're more like a little. Even though there's some tables there, it's more like a takeout place. Will your staff be trained? Because this isn't. Although I know we did it for the race, so we have people that are untrained. It's not necessarily people who serve alcohol all the time. But I mean, that was my only thing about issuing a license to a place that doesn't normally sell alcohol. Are you just doing it so you can make sure you can get people in there on a game day?
So twofold. So I think that on game day, people ask us all the time. So I think it's something we would do sort of like when we have special events or kind of like maybe on the weekend if we were to in the future maybe ask for a permanent license. So these 2 days really are kind of like for us to get a sense also of what it actually takes to do this type of service. And so that's why we want to start small. December 26th, we would expect that we would have a good amount of people there, but not overwhelming amount of people there. So we can, work on what we perceive is the best way to serve a beer or two to a family who's getting a small bite before moving on to a game.
Okay. So I would just say word to the wise. What you're going to have up there on that day is not necessarily going to be families coming up, obviously just come in to eat and want to have a beer. You're going to be dealing with a game crowd. So the only thing I would say is I would just be very careful on serving, because it's,
Yeah.
there's a lot of responsibility, and so, you know, that's what I do for a living, so there's a lot of responsibility with serving alcohol. Are you just gonna pick a couple of beers, different beers? You're gonna go with something that kind of goes with your food, like, just
So
curious
right now,
on
we're
what your
only
thought
thinking of
process is.
providing 4 options to keep it very manageable. And I will be the main person distributing the beer and checking IDs. And then from there, you know, in the future, we would kind of work out and see, you know, where could we get better? You know, slower is better. So we're not looking to purchase a large amount, you know, a small amount, and when it runs out, you know.
Yeah, absolutely. No, I don't think it's a bad idea at all. And I did see here that you guys did invest in a scanner?
We did.
Yeah, so
It's on site right now.
specifically for this?
Yes.
Oh, okay, great, because I know those scanners are not cheap, so you guys are very, I like that, you know, that you're serious
Yeah, I'd rather be safe than sorry.
in the process, yeah. Well, and, you know, maybe if this works out, maybe you might be looking for something in the, you know, in the future, so, okay, great. You guys have any, you guys have some questions?
No, I'm good. You asked the questions I was going to ask.
Okay.
So the beer will be kept behind the counter. I think that's what I
Correct.
saw, right? So everything is behind the counter. Do you scan everyone's? Just when people ask for it, you'll check their ID?
So we are thinking of doing 2 lines, one only for beer and the other one for food. So if you would like to purchase a beer, you will go to one of the registers where I will check your ID and the beer to your seating area, so that we can make sure that it's directly distributed to the adult that it's supposed to be.
So beer, no food. So one line would be strictly beer, no food. Is that what it is?
Well, you can order food, but to
Okay.
get your beer, you would have to, you know,
Oh, okay.
ask
okay.
it directly
Gotcha.
from me.
All right. The only other thing I question is, I'd be interested to hear what our experts have to say. And by that, I mean, Chief Kelleher, and if you had thoughts around this process.
Dealing with her through inspections and stuff, she's been very squared away at every issue.
Sorry, can you come up to there so people at home can
Yeah,
hear
you
you?
need the.
Thank you. Sorry, Dave.
No, I have dealt with this establishment in the past through inspections, through the permitting and inspection process during the construction of this, and they're very reputable, have done a great job, followed through on everything they've said, so I would say that, you know, if the plan she puts in place now, I think she'll follow through with it.
Yeah, and I think the 2-line is that's probably a good setup,
Okay.
so.
Yeah, well, the fact that she's invested in a scanner is, you know, those thousands of dollars, I believe.
She's going all in.
Yeah, no, exactly. The only other.
That's
yeah.
helpful. Thanks a lot, John. I
Yeah.
appreciate it.
Yeah, the only other thing is just, I mean, I'm not gonna tell you how to run your business. Just, I would say, I know, like, in the stadium, they card everybody. Like, if you're 80 and you come up, everybody has to show an ID. I'm not saying you have to do that, because that's not a rule, but just where you're maybe not used to selling alcohol, you know, rule of thumb is like, if they look 30 to 35.
Oh, definitely.
You know what I mean? Yeah. Yeah, just for your own safety, and especially if maybe this might be something you want to look into somewhere in the future. You don't want to start off with
Well, I
an
meant
infraction.
no, meaning that we wouldn't card people walking in the door, but to request alcoholic beverages,
Yeah.
you definitely would
Yeah, I
get
do have one
carded.
more question.
Yep.
Yeah, and I do have one more question. So you'll be the only one serving alcohol?
Yes, as we move forward, if it's something that we want to pursue, then we would do serve safe alcohol for the other staff members that would participate.
Okay, good.
Yeah, like I
You
said.
know, I
just-
must say that, you know, I am a very adaptive person, so that if something is not optimal, I would definitely reiterate and work on other methods. We do have Toast, and Toast has order and pay at the table. And I foresee that this is something that is something that we want to add to our service, either intermittently or permanently down the line. We would definitely be doing order and pay at the table just for alcohol, because that would allow us to track who's ordering and also make it simpler to check IDs and follow through.
Yeah, no, sounds good. It sounds like you've taken it very seriously and you have a plan in place, so, good. Anybody else, anything?
Nope.
Would you like to make a motion?
Motion to approve 2 one-day beer and wine license for Soul Taqueria doing business as Achelitos Taqueria for December 26th, 2021 and January 2nd, 2022.
Second.
Any other discussion? All those in favor?
Aye.
Aye. All
Good luck.
opposed? I don't have to say opposed, do I, when all three raise their hand? Okay. All right.
Thank you so much. I appreciate it.
You're welcome. Good
Thank you,
luck.
Margaret. Good luck.
Thank you. Have a great night.
You too.
Happy holidays.
Happy holidays.
You too.
You too.
Okay, next up, we have a fire department update. Chief Kelleher, Assistant Chief Buckley, Deputy Chief
The Chiefs.
Penvin, and
No Indians.
Deputy Chief Larissy.
Yeah.
Oh, we got booklets.
Booklets, yeah, we try to, you know.
No fooling around for you guys.
Did you bring it? No, Steph did.
All right.
All right. Well, here we are at our annual update, so I was told to make it brief, so we'll go as quickly as we can.
It's the holiday season.
It's the holiday season, so. if we
Well, I
don't-
think, you know, what happens is when a couple other people have come before us, it's almost like they're starting and telling us like what everybody does and, you know, so, yeah, so we don't need to hear
No,
that.
no.
Yeah.
Yeah, it gives
Just
you the,
where you guys feel like you are now.
We'll give you the year in review, so.
Yeah, great.
All right. So essentially this year again was dominated by COVID. We kind of pivoted from from testing to vaccines. We were called upon to help at Gillette Stadium with the vaccine rollout there. Deputy Chief Kendall will be talking about a lot of the vaccine activity around town. So that really, and here we are again in December talking about COVID again, wearing masks. So really, it's been ever present. Our run volume in 2020 was actually kind of stagnated, was down a little bit with all the COVID activity. People really didn't want to go to the hospitals. We kind of reviewed that last year. But now we're seeing it really skyrocketed this year. People were out, people were doing things were open. So we're going to set a record this year for runs as far as call volume. We're really starting to see the full impact of Norwood Hospital being closed and what that's going to look like in the future. That really has an effect on our operation. Our utilization, per unit is through the roof because of the time it takes to bring people to multiple hospitals that aren't, typically, we wouldn't be going to Boston. We're now going to Boston more and more often. And Gillette's busy with both construction and events, and I think next year we're really looking to have a pretty big year up there in terms of concerts and things from what we understand. Just want to talk about the department culture and the members of the department. You have true public servants at the fire department. They never say no matter what's going on, no matter what the mission is. Those individuals step up, and they're very agile too, so they can pivot from firefighting to emergency medical services to public health, whatever the mission is. They meet it. The department's 100% vaccinated, which I'm very proud of. Really, they're the only fire department in the area. I don't know how many of the town departments are 100% vaccinated, but that just doesn't happen. That's one of those things. We have mutual trust. It's through a lot of discussion, and I think that the people really saw the value in being vaccinated, especially as first responders, and I think they really stepped up in that regard too. So, part of the culture is physical wellness and physical fitness. Our membership is really invested in physical fitness, and they work out every shift, they take care of themselves, they try to eat right, so they think for the most part, we have a pretty physically fit fire department, more so than anybody else in the area, I think. The culture is based on mutual respect. Again, we focus on continual personal growth, we train. We're also constantly trying to improve our service. We're looking for ways to innovate in our industry, looking for ways to bring a better service to the citizens of Foxborough, so that's kind of where we're at as far as culture. And like I said, new challenges, they welcome them, they don't shy away from them. I wanted to kind of focus some of the discussion around the goals that the board has set for the town manager and how we as a department support those goals. So I just kind of picked out a few highlights and wanted to just kind of highlight some of that stuff. So one of the things we talk about is new business models, alternative revenue, grants. So I don't think there's a department that really gets more grants than us. We've been very successful. We've been very fortunate, from staffing grants to, the ladder truck was a huge success. We get firefighter grants, competitive grants pretty much every year. Our ambulance revenue is increasing. We're very diligent in how we, conduct ourselves as far as the ambulance revenue. Obviously the call volume helps that, but also diligence and billing practices, going after additional revenue that's allowed by federal government. So if we need to fill out reports or deal with the federal government in ways to get more Medicaid funding, we do that. Public health revolving account was something that we set up last year. So all the vaccines that we've given, all the testing that we've done goes into the public health revolving account, and that just funds the program further. So things like vaccines, when we have an outbreak in town of COVID in a town department, we come in, we do all the testing, the cost is absorbed by the public health revolving account. So that's really been good, because it hasn't really had to hit anybody's budget. I don't have to, build a highway department or build a town hall. We can just kind of come and take care of that, and it goes away. The apparatus repair revenue is another alternative funding source that we developed a couple of years ago that's been really successful. We have 3 towns that we're taking care of their fire apparatus. The chiefs are very happy with the service. It's very busy, obviously. This time of year, too, it seems when it gets cold, things seem to break down more. We have cell tower revenue, so we're having AT&T added onto the cell tower that was voted at town meeting. That's another, I forget the exact dollar amount, but that's, a couple $1,000s a month in additional revenue to the town. Assistant Chief Buckley was very aggressive in the FEMA reimbursements, so we hired a consultant eventually. Tom loved to do the reimbursements. He was really excited about it. So when we hired the consultant, he was really mad, but I said, no, you're too busy, or you have to take this away. No, that was like yeoman's work. Tom did a tremendous amount of work to get every dime that we expended back. We were working with the school department, finance department to really be aggressive and get that reimbursement. Another thing, we did the public-private partnership with Transformative Healthcare at the vaccine site at Gillette. So Transformative Healthcare is the EMS provider for Gillette during events. We've worked hand in hand with them for many years. That was Fallon Ambulance prior. So we have a long-standing relationship with them. They needed people to help with the vaccine, so we were hiring firefighters from the area, just like we would as a detail at Gillette Stadium, and they were working up for Transformative Healthcare. They were actually paying the area firefighters, which we still get the 10% administrative fee for that. So we billed almost $1 million last spring.
Wow.
So we got about $100,000 in administration fee back, which we lost the previous season from Gillette by not having events. So that was good. We kind of made up some revenue. Another one of the town manager goals was have board liaisons and staff embedded into different committees and boards throughout town. That's just a kind of a smattering of where we are. It's not all inclusive, but it's just a snapshot of the places where the fire department is embedded in different boards and committees. As you can see, we have people all over. So I think some of the other goals I'm just going to touch on briefly is the long-term capital infrastructure. So I think we have a pretty good long-term capital plan. It works for us. We're on time on most of our capital improvement and capital projects. we promote great customer service. We're constantly evaluating our service model and making sure it fits the needs of the town. Everybody that we transport in the ambulance gets a survey so that our service is evaluated that way. You know, we obviously are in constant contact with our community through our various programs, but we also get unsolicited feedback. So we get letters, phone calls, people dropping stuff off at the station. The community is very appreciative of the service we provide, and we really appreciate the citizens doing stuff like that. So it's really nice to see the kind of fruits of our labor. And we haven't had any citizen complaints in the last 3 years since I've been the chief. So we have a process for investigating complaints, and we haven't had to implement that process. I think Deputy Chief Laris will be talking about his interaction. He interacts with the businesses probably more than anybody because of his activities in fire prevention. So he'll touch on some of that. But we do have a presence in the business community, especially when with COVID and some of the shifts that we've had with restaurants. Trying to shift their business model outside or be innovative in how they deliver their food. Dave's the point man on a lot of that stuff. They want to have tents, propane, different things like that. That all puts pressure on Dave's side of the house. Obviously, we're very embedded in SEMREC. We want to see SEMREC succeed. As somebody that was there from the ground floor, I'm kind of, a lot of the chiefs have retired since SEMREC opened, so I'm like one of the last men standing as far as SEMREC. But I'm constantly on contact with Rob and trying to, sell SEMREC and pushing the agenda as far as regional 911, regional communications. That's been a wild success. So when you're successful, people call you and want to know how you did it and what worked, what didn't work, some of the pitfalls. So I think we entertain a lot of those phone calls. And I think the other goal, we're always looking for ways to be more efficient, more productive. That's kind of our mantra is, we're definitely efficient. We're always looking at new ways of doing things and not stagnating. So that's kind of how we fit into what you guys said as far as the goals for the town manager. So Assistant Chief Buckley, this is kind of just his program areas that he's responsible for on a day-to-day basis, and then he's just going to run you through some.
So one of the things that we've been continually working with is to become an nationally accredited fire department. I gave you those 2 booklets there. That's 2 parts of a 3-part analysis of how we work and how we run. The standard of cover that you see there, that was, we actually had the accreditation actually came out for a 3-day conference with us for those, and worked with the business people in the community and did an analysis of what the public is looking for, and we've created that booklet there. It's good reading if you're really bored. That one actually came out really good, though. And the second one you see there, the strategic plan, this is really where the fire department, and not the 4 gentlemen that you see sitting here, this is the entire fire department and where they want to go as the department moves forward. We actually tasked members of the department, not just the senior members, but we actually had 2 members who were newly hired who came from a different department, so that we'd have a general idea of where they came from, because a lot of the members of the department only worked in Foxborough, never worked in another department. So we used their insight to see what are we doing right and what are we doing wrong. So we've moved to an applicant agency. We're in the last phase, so to speak. There's 220 core competency questions that we have to answer, and we're working through that right now. We have 18 months as of this month to become finally certified. We're hoping to get that done sooner than later. I think we've mentioned it in the past, but we're trying to be the first municipal department in Massachusetts. Westover Air Force Base is accredited through this organization, but that's Department of Defense, so we're trying to be the first municipal one. There actually isn't anybody right now working towards this in Massachusetts, so I do believe that we will succeed in that. So there's only 292 accredited agencies in the world, both municipal and DoD, with some private fire departments in the Middle East and 12% of the US population is protected by an accredited agency. So we're kind of excited about this, but like I said, if you look through those books, you'll see a lot of information. It's really opened our eyes to see how things are done in the department, because not everything that we do is perfect, but, you know, we're always looking to improve in the way we deliver our services. HR, so just to explain this a little bit better, so the past 3 years, the yellow bar there is the actual sick leave hours that were logged for that year. So in 2019, 875 hours of sick time was used out of all the employees. Of those 875, 618 of those were for a long-term sick leave. So that was somebody who didn't get injured on duty, but they got injured outside the department, were out long-term. One of them was a broken leg, and the other one was a cardiac issue. So if you back those two numbers out, you subtract that number from the total, you had 257 total sick hours. That was, you know, just not feeling well, or whatever the case may be, cold, flu at that time period. And we had 152 hours in 2019 of family sick leave. Then you go down to 2020, so the total number was 482. Long-term sick leave was 178, and that was a back injury, so you had 304 hours of sick leave there. That was not a long-term injury, and 223 of family sick. And in 2021, we had 763 as of yesterday, 763 hours of sick time on the books. But of those, 235 was a long-term injury. That was a leg injury incurred outside of the fire department. So you're still looking that we only accrued 235 hours of, again, not feeling well, not coming to work. And we're trying to, obviously, I think the whole world is you know, when you have the gray hairs I have, we were brought up that you just went to work unless your arm was falling off. We have to get out of that. If you don't feel well, we don't want you coming to work anymore. So, but even with that, you know, we still dropped the total number to 235, and we only used 149 hours of family sick leave as of yesterday.
Hey, Tom, the
ahead.
2020 there, the yellow bar is the total, right?
Yes, that's, if you looked at our records for sick leave, the yellow is how much was used. And then I wanted to just let you know that the long-term sick leave was what was driving a lot of that number.
I think it would be an even better story. I think the 2020 yellow bar would be somewhere in between 2021 and 19. So it would sort of show the decline
Yep,
over time.
exactly. So injured on duty, so these are IOD claims that we've had in the department. So we had 7 total claims submitted to Cabot Risk. 2 of those employees had lost time. Again, that was an ankle injury on duty, and the other one was melanoma. So that was a total of 144 hours of lost time due to injured on duty. Of those 7, 5 employees did put in a claim, but they didn't have any lost hours. And a lot of time, what they're required to do that for is that goes into their records, so later on, when they retire, there's a record that they were injured on duty. So somebody who maybe had cut their finger, we actually had one the other day, sliced his finger open, they drove him up to the Partners building, they were able to stitch them up, and they were able to come back to work. It wasn't anything that they had lost any time, but it's still a claim within the Cabot system.
So Tom, how's the melanoma fall into on duty?
It's presumptive.
Oh,
Cancer presumption.
Cancer presumption.
Okay.
It's just assumed, the Mass General Law just says that you got it on duty.
okay.
So we had a lot better year last year than the year before at Gillette. So we had 37 total licensed events with fire department resources. There were 3 private mini concerts on the field with fire department resources. So there
Rolling
was,
Stones?
yeah. There was 3 separate entities on the field, 3 private concerts. But we actually staffed those because of the fire alarm system, and one of them had pyro. And so that's a total of 41 events that required fire department resources and logistics. I think as the chief said, they're talking real heavy events next year. they're talking a lot of events. So knock on wood on that one.
So, what we do in the fire prevention, obviously, is basically, it's all the permitting, code enforcement, and inspections. That's what's the whole premise of what we do. So our goal this year, and pretty much our mission this year, was to try to guide businesses and help businesses and contractors alike survive in this economy and try to streamline all the permitting, not be as restrictive of what things should be, just to help them survive in this environment. So we've worked with business owners with temporary tents, setups. We've helped them with the permitting of propane to heat these tents and these tables, and permitting food trucks to be at their facilities to work to try to generate some business. So we've made a strong effort to work with them directly and let them know that we're available to assist in any way. That was basically, it was one of those things that they needed us because they had nowhere else to look. This is so unique. They needed us to assist them, and we helped them out. What we have here is, I wanted to go over the inspections we do. So we did this last year, but we did a one-year comparison. This year I wanted to do a two-year comparison because 2020 was such an odd year. Like, there was, restaurants were closed, businesses were closed, schools were closed for certain periods of time. So what we wanted to do is just get a comparison to show you what type of inspections we do and what the volume of inspections that we do. And you'll notice the biggest number of inspections is the top line, is the 26F residential inspection. So that's anytime anyone sells a home, there has to be we have to inspect it for smoke detectors and carbon monoxide in order for them to close. So between that line and the new construction line, they generated probably the biggest jump in the inspection process, in the categories. But what we found is between 2020 and 2021, we had an 18% increase in inspections for that year. But going by 2020, it was such an odd year, things closed, and we weren't able to access a lot of buildings and stuff. It's really not a number that we were really confident of comparing with. So what we did is we compared what we did in 2019 to what we did in 2021. And the number we came up with there is a 14% increase in inspections and services that we provided to these businesses. So it's not from 2019 to 2021, it's comparing 2019 to 2021. And with the new projects that are coming into town, we expect a real increase in how many inspections we do and the time it's going to take. So when we do a home inspection for smoke detectors, we allow a half hour for that inspection. From the time you leave till you get to that one, till you get to the next one. It's a half hour block for each one. We just did an inspection at Gillette Stadium that was 7 hours. So when we do a residential inspection, we got it down to a science. They're very easy, we in and out. So we're anticipating a lot more man hours to be needed that we'll be using to accommodate these new projects coming to town. So what we've on the ones that drove it up for the 18% and the 14%, those are pretty much, they were from like economical reasons, the homes, sales and all that. The other inspections are going to be the yearly inspection. So every new commercial building we put up is inspected yearly. These are going to be added to our new inspection schedule.
And Dave, if I might, obviously, how efficient all you guys are, you're training other firefighters to do the same job you're doing?
Yes, yep.
You have like a crew of 3 or 4 guys, or does everybody learn?
No, only on certain ones that the captains will go out and assist on. But when you're into commercial and stuff like that, Tom and I are the only ones that are credentialed to be able to do that. So I just went the fire academy and got credentialed to another level, which allows me to oversee people. If that were the case, it just brings me up another notch in the credentialing level in the Massachusetts Fire Academy.
That was something that came out of the, when the station nightclub fire happened, there was a series of laws that were changed. One of the things that they found as a result of that, when they analyzed the fire inspections and fire service, was that that was the only person in a community that required zero licensing, zero recognition from any agency. You were a fire inspector, that was it. You could go do fire inspections with no training, no nothing. So that's when they added the credentialing piece to, you know, to give these inspectors credibility as far as going out and doing the inspections. So now they're trained to a standard. They have to do continuing education, just like a building inspector, electrical inspector, and stuff like that. So kind of the old days of just sending anybody out to go do a building inspection, and unfortunately, those days are kind of coming to an end.
Yeah.
And is the cost, let's say the man hours, is there a cost to that, like say up at Gillette, these projects, is that all, does that, maybe if it doesn't come directly to the fire department, does it like come into town hall as when you're pulling permits and stuff? Is that how, is that how that, like, you know, or,
So
I mean, if you're gonna spend all those hours at Gillette, I'm sure there's a way that the town gets compensated somehow, no?
No.
Well,
$100 fee.
Well, the bulk of the compensation is through the building department.
Yeah.
Okay.
So as far as the fire department fees, they're very minimal. So, for an example, let's just say I go up to do a sprinkler, so they just did the clubs. So this is what I was talking about, the clubs. So they did the Salt End Zone, the clubs, Northeast Club, Northwest Club. So we go up, we do the sprinkler inspection, we do the fire alarm. So the club project itself for both sides is a $50 permit for each one of those. So it's $100. So the Salt End Zone was the same thing. So it was $50 for the sprinkler for that, $50 for fire alarm. So that time that the town recovered, it was $200 for me to be up there for that time period. So,
Yeah.
and it's not myself, it's, you know, the electrical inspector, the plumbing inspector, all them, but as far, they're compensated on the building permit.
So basically, what we hope is that by these projects existing, more revenue comes to the town in a different way.
Exactly.
By them being there. So unfortunately, the fire department's gonna work their fannies off to make sure they're okay, they're safe.
But
And then,
my point is, like, when we have commercial development, it's more time for the fire department as opposed to residential. So there might not be as many commercial projects going on, but they consume more time than a residential project would.
Yeah.
So an example, like we have the projects coming up for the 50 apartment building over here on 29 Wall, and then it has a 3,000 square foot or 3,500 square foot commercial building out front. So I'll be inspecting all 50 units and the building out front. So to inspect 50 units, that unit building is $100 that the town is, the fire department is getting from us. So, yeah, the revenue is.
Sounds like a time to review those projects.
So what I wanted to talk about next is, this is something that's really, it's a really good project that we came across. So the state, any apartment building, 6 units or greater, so say, you know, just take any building that's 6 units or greater up to, in Foxborough is up to 12. So the state sent out a notice that every one of those buildings by 1989 had to have a fire alarm system. So as time's gone up, what they did is they left it up to the discretion of the fire chief to make sure it gets done and the building owners. So as time has gone on, it's got kicked down the road, kicked down the road, kicked down the road. Now, this fire marshal 2 years ago sent out a notice to us and said, you will towns will no longer get a notice to say you must comply to this. And then we saw it, and we were like, what notice? Like, what's this all about? We looked into it. This had never been dealt with, so now it was dropped on our lap. So we have 59 buildings in town, so that that meet this criteria. So we sent out letters to, we didn't do them to all because we don't have the manpower to do them all at once. So we sent out letters to a group of the building owners. We got replies, we met with them, we sat down with them. So out of all the buildings, I think we met with 27 to begin with. Only one was equipped with the proper fire alarm system. So what we did is we met with these people, we went over everything, and surprisingly to me, we only had one person that resisted doing this. A lot of them were like, we didn't realize we weren't in compliance. We didn't realize that we didn't have the full safety, devices and stuff in place, and people have been putting them in. So what we did is, it's a huge expense. It can be $30,000 a building for some of these buildings. We have one building owner that did 10 of his already. So he was just, he felt the need to protect his residents, and he jumped on it. So we have 22 of these buildings now in full compliance in town. You would think that you're renting an apartment that you would have full fire alarm systems and full protection, but that wasn't the case. So we have 74 families now have fire alarm systems in their apartments, and they're safe. So our goal is to have it by the end of '24, and the reason we've given that time frame is because of the cost and the time, and the time that it takes to do it. A lot of people don't have the means to do that. That's Tom's, but I just want to close on that. The building we just had the fire at, that building is a 5-family. It's been in the news as a 6-family. It's a 5-family. We had a fire there last year that it was a cooktop kitchen fire we had. When we were there at that time, we found that they weren't in compliance. We had them upgrade their smoke detectors that were in some of those apartments, and luckily that was the case because they were alerted by smoke detectors. People woke to the sound of smoke detectors, and so credit to that guy putting in the smoke detectors or us finding it. It was a pretty good find.
And one thing too, that Deputy Chief Laracy spent a lot of time on this, finding cost-effective alternative ways. Now with the technology, wireless detectors, you can save on, running conduit and wires and stuff. So he really spent a lot of time researching the code and trying to apply different methodologies to try to really make this, cost-effective for a lot of these building owners. So that was really a lot of effort on his part. It's kind of, it's one of those things we uncovered, and it's been.
And just another quick question, is this a finable offense after 2024? Will the state back you with fines, or?
The state is still leaving it with the town, with the department. So if we find a building that's not in compliance, and we have an individual now that really does not have the means to do it. And what I've been doing, I've been working with that individual and saying, let's piecemeal it. Let's get the smoke detectors in the units that are not part of a fire alarm system. Let's at least get smoke detectors that are hardwired and notify everyone in each apartment. So, because these systems, they're pretty, what they do is that you have inside the apartment, you have smoke detectors that alert just the unit. And there's a heat detector in the kitchen that will alert the whole building. So if there is truly a fire, when the heat rises, it will trip a heat detector. A smoke detector, you can have false alarms. You don't get false alarms on heat detectors. So we're allowing them to do local, just in the unit. So at least the occupant is alerted to smoke or fire. And then we're letting them phase it in. So we've made agreements with people, we'll let them phase it in. Because, some of these old houses, they're going as high as $30,000. But the wireless system that the chief was talking about, it's approved by the state fire marshal and NFPA 72. So these devices can be wireless, and it does dramatically reduce the cost of the install, but it makes the cost of the maintenance higher over time. So each device takes 6 batteries at $3 a battery. They last 3 years, so. But it's an alternative. And so far, we've had only one person resist, and
Now we have Southeastern Massachusetts' favorite public health nurse.
Yeah.
Well, good evening. As the chief mentioned, the closing of Norwood Hospital and the occurrences associated with the pandemic have really stressed our providers in terms of delivering care and transporting our patients. So to date, to writing of this slide, we've had 1,877 transports, and you can see the breakdown between the advanced life support, or ALS, and our basic life support transports. The members have been dealing with a much higher acuity secondary to some of the scarcity of resources in the surrounding area hospitals, really challenging them to advance in their training and advance in their patient care delivery. One of the things that we've been collaborating with and in discussions with Sturdy Hospital is the community administration of monoclonal antibody therapies for patients who are COVID positive. They found that there has been some success in patients who are mildly symptomatic to severely symptomatic and reducing the severity of their illness and shortening the length of their illness. Always looking at ways to improve the delivery and quality of care that our providers provide in the community. Next month, we'll be deploying automatic mechanical ventilators so that when we have patients who are in critical condition, we have the ability to provide ventilatory management where we can provide the right volume and the right rate and the right concentration of oxygenation for our patients who are critically ill. We've also initiated an app-based pediatric resuscitation program, which is proven to help reduce medication errors, especially in patients who are more vulnerable, like our pediatric patients, who we don't often deal with and give medications to in a crisis situation. And when that happens, we don't want to be trying to do math on the top of our head. You know, we can trick ourselves when we think about the way we have System 1 and System 2 thinking. We also continue to promote a relevant, meaningful EMS training to our members to enhance the delivery of care in the community, continuing to advance on our pre-hospital ultrasound program. Having been the first in the state to do that, we have effectively implemented that in the statewide protocols based on the success of our program locally. So the state has adopted that for services that want to initiate that as well. We have worked closely with our partners at the COA and Human Services, with community outreach and home visits. We were able to provide in-home vaccinations for both flu and COVID vaccine. We've also assisted with home medications and med reconciliation, such as B12 injections, and going over patient medication lists to make sure that when patients are discharged from the hospital that they're actually taking the medications that were prescribed and taking it properly. I can't stress enough how our partnership with Human Resources and Human Services, the social workers, Christina LaRose and Pam McGuire, has been a phenomenal partnership, and we've been working really closely with them to try to make sure that we can tend to all the multiple needs of our patients that have social services demands. We also, as our approach, part of the accreditation, and I can't say enough how much Chief Buckley's been working on this. It's been a phenomenal endeavor, an incredible workload. But part of that appraisal is to really approach how we approach community wellness and community health. So we really want to try to expand our CPR teachings and offerings in the community. So we were able to purchase new CPR AHA compliant mannequins to help us proceed with that endeavor.
So one of the things I'll point out is that getting creative with the financing. So we were able to use CARES Act money to buy those ventilators. So we're not using, trying to compete for capital funds to purchase new things. We also bought new cardiac monitors with CARES Act funding. So we got creative, got it approved by the state. So again, more reduction in the competition for capital funding.
And additionally, when we have these ventilators, we're able to apply 99% HEPA filtration to a closed circuit system so that you're also reducing the aerosolized exposure risk potentially of COVID.
Which is why the state approved it.
We continue to conduct our BP clinics every 2 weeks at the COA, where we can have the ability to do blood pressure screenings, blood sugar, and total cholesterol screenings, as well as med reconciliations, which basically means we go over the meds and make sure that people understand what the meds are and how they work. Our COVID testing to date, we've done over 2,300 PCR tests, both locally, that we report to the DPH through our own portal, that when we test doing rapid PCRs or our 24-hour to 48 PCRs with the Broad Institute. We've also helped support the mass testing site at Gillette Stadium. With regard to vaccine, we were the central distribution hub during the initial rollout, so we received the allotment from the CDC and then dispense it from there to area departments and area VNAs as well. Again, we worked very closely with our school nurses, again, phenomenal staff there, and our COA Human Services to conduct clinics both locally and within the home. And again, the vaccination efforts at Gillette Stadium, we have a great relationship with Transformative Healthcare, and we provided a lot of person power to assist in the vaccination effort there. So to date, we have, this year, we provided 1,200 Moderna vaccines and about 320 flu vaccinations. It's really tough to try to gauge the demand for flu, but we're able to have just enough to make sure that we met that demand. And we have another Moderna vaccine clinic on Monday, the 27th as well. Thank you, Christina. And Chief Kelleher, thank you.
All right, so.
Tom, is that with booster too? Moderna, so total?
So we just started the booster shots,
vaccines
yeah, November
and booster,
3rd.
That number.
Yep.
How we doing time-wise? We
A little over.
little over?
Yeah.
Oh, boy.
It's all right.
So I just want to talk again about some of the stuff with the staff and things like that. So basically, last week, in 3 days, we had a multiple alarm fire on Central Street, displacing multiple families. Then 2 days later, we went to a multiple alarm fire in Franklin as a result of a pretty horrific domestic violence incident. And then that night, we had a motor vehicle accident on Route 1 that resulted in pretty significant injuries of an 18-year-old male who was ejected from the motor vehicle. Again, our paramedics did exemplary work. Patient had 2 collapsed lungs, which requires the paramedics to push a 14-gauge IV catheter through their chest to relieve the pressure that's building up in their chest. So it's called a tension pneumothorax, and it's a needle chest decompression is the procedure. That was also aided by our ultrasound. So again, yeoman's work by our paramedics up there on Route 1. So that's in concert with several motor vehicle accidents over the last week. So we deal in tragedies, but tragedy around the holidays is compounded by Christmas and things like that. So I think we talk a lot about physical well-being and our physical fitness and things like that, but there's also a mental well-being aspect to this job too, and it's just one of those things that these guys they do great work. These guys and ladies do great work. It's one of those things, like right around the holidays, it gets tough, especially when you see things like domestic violence really erupt and stuff. It's especially tragic. Our training regimen, again, we've really amped up our training over the last 3 years. We're really, focusing on a variety of things. Our firefighting capabilities, I think you really saw that in play last week on Central Street. The physical fitness end of it, the training end of it, things just worked seamlessly, and that really came out as a positive impact on the extinguishment of that fire. By all intents and purposes, that fire should have been a whole lot worse, but it was the training, the aggressiveness, and the tenacity of the membership that really took care of that. You see, we recently had a member graduate the recruit firefighter training program up top there as a result of retirement. You see the ice rescue training, that's an annual favorite of everybody's. Go out cutting a hole, swimming in the Ponce Reservoir. We were very fortunate back in October. We were guests of the Boston Fire Department out on Moon Island. They have a new state-of-the-art training facility that's called the Flow Path Simulator, which kind of mirrors the way that wind affects a fire and different ventilation techniques. So when people smash a window out thinking they're helping, that can draw the fire to different parts of buildings. So it really gets into some of the science of why certain things happen during fires. And that was, we were very fortunate because not a lot of people have the opportunity to go out to, Boston to do the training. So we leveraged some personal relationships and were able to kind of sneak in and get that done. It was awesome. At the bottom is Keating's Funeral Home. Again, we take advantage of buildings that are about to be torn down to kind of hone some of those firefighting skills and really practice. So this is in addition to the training regimen that Deputy Chief Kenvin puts on. We have Captain Pontini, who's our training coordinator, that kind of maps out all the training, and then, again, that all plays into our Class 1 ISO rating. So just want to, again, the physical fitness is a big part of it. You can see the groups, they have a regiment that, they work out every shift. It's kind of a team sport.
Mike, when you have, it might be a question for Dave. So when you have these, fire, especially more for an apartment building, let's say, than at home, So do any of those signal anything to a fire department? No, right? So you have to wait for someone, so then you have to wait for a call. Someone was woken up and then someone has to call the fire department,
Well,
right?
that depends on the building. So all these new ones that we brought into compliance, they call right to the fire department. So everything, so that was the purpose of these systems that are installed. So if you cook food and if you burn food in your kitchen and you set off the smoke detector, it doesn't call the fire department. If the main hallways or the basement or your heat detector goes off, then it calls the fire department. It dumps the building and then calls the fire department, well, at the same time. So that's part of the new systems that we're just putting, that's why I say when we talk about protection, these are great systems that all these people put in. I give them all credit because they reacted so quick to it.
So that doesn't go through SEMRAC, that comes right to you guys.
So, yeah, summer.
Yeah. So, just some of the needs and the gaps that are coming in the future. One of the issues we have is staffing, and we can talk more about that on the next slide, but, one of our ambulances is dedicated. The firefighters are in that ambulance 24/7. A lot of what we do is cross-staff pieces depending on the call, but we've dedicated 2 firefighter paramedics to be on the ambulance. That doesn't mean if a fire comes in, they're not going to the fire, but they're going to the fire in the ambulance, because if it's a false alarm or it's not a building fire, they can go on to the next call. We should probably look at doing a second dedicated ambulance for the town. It's busy enough that, we could definitely support that. There's issues in the healthcare industry that are really affecting our ability to deliver service. And some of those are bigger than Foxborough. Obviously, we're not going to solve them here locally. They need to be. It's a more of a national issue or a more global state issue. But one of the things is access to psychiatric care and mental health. It's at a crisis. And one of the things that are affecting this region is that we lost 67 psych beds when Norwood Hospital closed. Those haven't been replaced. So those people end up in the emergency room. They clog up the emergency room, and they take up beds. There's nowhere for them to go as far as care, so they end up sitting in the emergency room, and when our ambulance shows up, those beds are taken up by some of those patients. Another issue that's being faced by the Metro Boston area, the lack of available ambulances. A lot of manpower and things have been shifted to vaccine testing and other stuff, and there's not a lot of people that are getting into this business, so there is a shortage of EMTs and paramedics out there. So that's another issue that a lot of the private industry paramedics and EMTs, that they're lacking. So there's a shortage of ambulances. So being compounded by the psychiatric issue, and then again, whatever the Norwood Hospital, 50, 60,000 visits a year in their emergency room, those people went other places. So they went to Sturdy, they went to Morton and Brockton, Needham. So that people didn't stop going to the hospital when Norwood closed, they just go to other hospitals. So then these hospitals were oversaturated, compounded by the COVID crisis, compounded by the psychiatric, it's really, really putting pressure on healthcare. So one of the results is that we have our ambulances sometimes. They sit in the ambulance bay with a patient in the back and can wait 45 minutes until they clear a bed for somebody. That happened the other day. We brought a person, happened to be up from the state police barracks. We brought them into the Sturdy Hospital, and they sat in the ambulance bay for 45 minutes until they had a bed available. So that's really, like, you talk about utilization. So what used to take 90 minutes now can take 3 hours, and that ambulance is tied up and gone. So there's days where the crews get in the ambulances and they leave at 8 o'clock. They don't come back till 6 o'clock at night. So it's really busy. So
They've been talking about it on the news. Now I think they're going to stop the non-essential operations or procedures and stuff,
Right.
because they, I was listening tonight on the news. They just don't have the staff. The hospitals don't have the staff either.
yeah. So these are our 3 ambulances at Sturdy Hospital once over the summer. So it's, we're consistently trying to put 3 ambulances on the road, but there's risk with that. Which I'll explain in a second. But the other thing we need to still just keep in the conversation is eventually have a substation, a secondary place to deploy apparatus to the highways, the south end of town, East Foxborough. So we really need to consider that as the town grows, as we have, commercial development. So this is our current deployment model. We have 8 people a shift. We have a captain, a lieutenant, and 6 firefighters. We do a little over 10 runs a day on average. Like I said, we try to have 1 dedicated ambulance and 1 dedicated piece of fire apparatus. And what's nice about the versatility of our ladder truck, it also has a pump on it, so if we need to extinguish a fire with it, it has that capability. Our old ladder truck did not. So one of the things, so that's, when we have back-to-back ambulance runs, that takes out 3 of the 6 pieces of apparatus. Our 2 ambulances go, and we lose an engine as far as cross-staffing. So the second ambulance cross-staffs the second fire engine, which would be the truck that would get a hydrant if we had a fire. So, and then if we take the third engine, take a third medical, which happens at least a couple of times a week, that's what we have left. And that's if all things are normal. So we have 1 fire truck with 2 people on it, usually the captain and a firefighter. So everybody else is gone. Now, 25% of the time when that ambulance goes out, the paramedics need a hand in the back, so we would take somebody, which would leave 1 person back. So like the accident the other night on Route 1, 4 paramedics, the patient was really critical. They needed a lot of advanced procedures, and when you're doing things like, decompressing someone's chest, that's a pretty, high level, high acuity call. So those 4 people went down to Rhode Island. It took a couple of hours to turn that around. So really, when you look at it, we're really on the wire as far as utilization. Just to compare some of the SEMREC towns, we talked a lot about what the SEMREC towns compare, as far as run volume. So if you look at us, population-wise, we're the smallest. We also have the lowest staffing per shift. We have 1 station. So if you look at the square miles covered per fire station, we're covering a large area. So the next closest is Norton with 14. They have 2 stations. They cover about 14 square miles per station. Our budget's the lowest. Norton is operating off a SAFER grant, so there's federal money, which changes federal dollars paying for 100% of some of their firefighters. That's why our budget, Norton budget's fairly close. But you can still see we provide exemplary service as recognized by the ISO, so we're still a Class 1 department. But when you look at apples to that's what's good about SEMREC now. We have apples to apples data where we can compare our run volume to our neighbors, and you can see that Easton's busier than us by about 100 runs, but we're busier than Mansfield and Norton, but everybody has more staffing than us. So it's fairly significant, our volume compared to Norton and Easton. And the other thing, again, getting back to the utilization piece of our people gone longer, is every one of those towns is closer to a hospital than us. Easton borders Brockton and Taunton, so they can go to Morton or they can go to Good Sam or Brockton Hospital. Mansfield has access to Brockton via 106, but they also border Attleboro, and then Norton is the same. They can go to Morton and Taunton, and they border Attleboro. So again, you're seeing us we're really efficient, and we're really trying hard to cover all those calls. But again, there's risk involved in that. So, and a lot of times we're short-staffed here in town.
It's funny because they have the highest population, but they're the most congested out of everybody. They're only 9.7 miles.
Yeah. So that's kind of how we line up. So again, that's apples to apples. That's real. So, and that's it. I try to keep it brief.
You're only a half hour off over time, that's all right.
That's all right. It's like we wanted you to keep it brief, but it's, I think for us, it's good to hear, and it also gives the people at home a chance to hear on what's going on with you guys. So I think it's a good thing. I don't know, any direct questions, guys?
Appreciate your service.
Oh, thank you.
What an incredible job you guys did last week, too, on Central Street. I mean, to think that the fire started at 5 and it was already knocked down when I walked by at 8, and people were already rolling up hoses, and, sure, the training and you guys have really phenomenal job.
If you want a quick overview, I can give you a real quick overview.
I was thinking earlier, I was like, oh, we're going to get to hear.
Well, all right. All right, 2 minutes. So.
Well, plus it turned into much more than you guys anticipated.
Absolutely. So yeah, 91 Central Street, 5-unit multifamily apartment building. Alarm. We got multiple phone calls for a reported building fire just after 5 o'clock. So all of our downtown construction is legacy construction. It's 1900, 1910. One of the concerns from a firefighting aspect is balloon frame construction, which means that the studs go from the cellar all the way to the attic. Usually it's an open void space. A lot of the buildings downtown have been cut up over the years due to construction, added different pieces or cut different pieces of the building up, added bathrooms. Again, have pipe chases, a lot of places for fire to kind of hide and extend. One of the pieces, you can see the building has like an alcove in the middle of it. That was a little bit challenging. Just very cut up. So this is probably 15, 20 minutes into the fire. So first due engine company was Lieutenant Rob Lucas, had a very good crew with him. Recognized right away that he had a basement fire. So one of the things you need to do when you have a fire in a building that's balloon frame construction, basement fires need to get down and extinguish the fire in the basement pretty quickly. His crew got to the bulkhead, recognized where recognized right here, so the bulkhead's right there on the right. He went in. The people that were on the ladder truck went in. There was a padlock on the door. They were able to force the door, get it open, help them advance the hose line into the basement. Started knocking heavy fire down. Again, everyone recognizing that it's this type of balloon frame construction knew that the fire was going to go up, so they immediately came out and began to throw the ladder to the roof of the building and start to really set up. That's the thing, when it comes to firefighting, you only have one chance to set everything up, and depending on how it's set up, it's either means going to be successful or failure. That's the thing. So recognizing what the conditions are and then setting up so that the gentleman that was driving the ladder truck that day, if you look, there's about 10 feet of wire that runs down between cable, all the utilities, which really hinders our ability to use our aerial ladder. So recognizing that, the gentleman that was driving the ladder pulled up and backed up about 5 feet, which put the turntable just under the wires where he could access the building. So it was really heads up, paying attention. That's, muscle memory, really, the training kicked in, so it was phenomenal. So you can see the fire conditions. So the fire's spread up into the attic. You can see the pressurized smoke coming out of the eaves in the the front of the building. It was really, they give you an indication that there's a lot of heat, a lot of smoke up in that. One of the things we need to do is cut a hole in the roof to try to give a place for all that heat and smoke to go. Otherwise, the fire is going to continue to spread in the attic. So again, the gentleman, yeoman's work on the ladder truck, after forcing the door, helping them advance the line, they went back up, climbed to the roof with a vent saw, all their gear on, and cut a 4x4 hole in the roof to allow that heat and smoke to rise out of there, to give us, an opportunity to get up there. We got to open up ceilings, open up walls to extinguish pockets of fire. So Mansfield was our second due engine coming up 140. They grabbed a fire hydrant right by Bassett Street, laid a secondary feed line, so we had redundant water supplies coming in from two different areas. We used their engine to pump water into a hose line. They went into the first floor, went down to the first floor apartment, started opening up the wall above the fire. Chief Buckley arrived. He went to the rear of the building so we could get eyes on the rear of the building. He observed fire extending up the side of the building that was coming out of the basement window in that alcove area. So we had an exposure issue with the other half of the building in that alcove area, but also exposure issues going up the back of the building. So it was kind of
Wow.
Fire spread up into the front, get into the gable end of the front of the building. But you can see the fire coming out of the back of the building. That's the vent hole. That's what it's supposed to do. But you can really see there's not a lot of pressurized smoke coming out of those soffits or those eaves. So that's a good thing. So you can see here too, compared to this picture where it's really pushing out, they did exactly what it was supposed to do. It gave us that opportunity. Manpower intensive, it takes a lot of hard work. The floor of the attic had 3/4 inch plywood, so to push that up and try to get that out of the way while you're trying to extinguish fire above you is a tremendous amount of bulwark. So that's part of the reason why it was a manpower intensive operation. But again, you can have a lot of confidence in these buildings. It's not, the new construction has trusses. The roofs are made out of trusses with gusset plates. They burn out, the roofs collapse really quickly. This legacy construction is really resilient, and you can sustain a lot of fire damage and still, be fairly safe to work in. So that was one of the things that I had as I was watching the people work. I had confidence that the construction of the building was going to stand up to the fire conditions. So you can kind of get an idea of the proximity of the wires so you can get an appreciation of sneaking those 110-foot ladders in there. So that was it. Again, we were able to keep the fire contained to that piece of the building. Did as much salvage as we could of personal effects and things like that. We were able to help some of the citizens recover some Christmas presents, things like that. So in the end, it's, you know, no one got hurt. No firefighters got hurt. I think it was a fairly good outcome considering the time of year and the weather and things like that.
So you had Mansfield and Sharon were both there?
Mansfield, Sharon, we ended up
You
having
have Stoughton too?
Plainville, Stoughton came later on, yep. Yeah, so as
Rentham too.
we started to get the fire under control, wanted to try to relieve some crews as they were working, so that's why Rentham and Stoughton came to help relieve some of the guys. And
You had North Attleboro covering the stations.
Yep. Yeah, North
Go back to
Attleboro.
the first slide of the file.
And
So-
throughout the whole process, Chief, the inhabitants, were they already starting to be outside when you got there? And
Yeah, so,
and obviously head counts and make sure
yeah,
that-
so in concert with the, police officer was there, somebody had told me that everybody was out of the building, one of the occupants said everybody's out, but we have to confirm that. So we confirm that not just once, but a variety of times we do. So we have, one of the mutual aid, Walpole was one of the mutual aid companies, one of their assignments was a primary search of the residences. So they go through and check the apartments, and then we do a secondary search. So somebody different would do a secondary search, just again, take a sweep of the area, make sure, check the beds, check under the beds and things like that, just to confirm that all the people are out of the building.
As the fire is going?
Yes.
Yeah.
Yeah.
Is that on television? Fire department, call out. Like Chicago Fire watch it all the time. You wonder how much of it is real and how much of it,
How much of it is real?
Yeah.
And just, I mean, you're in concert all the time with Council on Aging. They were a staging area for the residents. I heard that,
Yeah, as far as the location, it couldn't have worked out better. And then, yeah, I felt bad. One of the chiefs we have the keys to the lock boxes, so he went down, he asked me if there was a burglar alarm on the senior center, and of course I said no.
There is.
It was.
So there is a burglar alarm on the senior center.
you now know.
We were able to open this. I felt bad breaking in, so I called Mark Craig as soon as I had a free minute. He was thrilled, and then, that's just, that fed right into his wheelhouse. He took that on, he took those people in. I mean, God, by noontime, they had everything they needed. He really was terrific as far as how, he took that on. He got in contact with different people, getting them housing, the social workers were
Yeah,
great.
they secured lodging for 2 weeks.
Yeah, I heard that relatively quickly. A lot of volunteer agency coming in to
Yes.
help out too,
Yeah.
community people.
Yeah, so the human services really stepped up.
Yeah.
No, it was really-
And this was
You know,
really,
shout out to, I heard that Linda Walsh was right up there with
Yep.
taking care of you guys too with some coffee or hot chocolate or something like that. Foxborough's a great community.
It really is,
People
yeah.
really.
Linda's always involved in
Yeah.
helping people.
this was really a textbook example of organizational teams working together, where you had, police, fire, council, human services, public works, everybody that was involved all worked together to get this done. And then, plus the team, the support from other communities around us made it a really successful event. And Doc, you noted that the fire started around 5, I think Chief was around there when the alarm came in. And I think I got there about 7:30, and it was already out by 7, I think.
Yeah.
So, which was pretty amazing when you think about it. I mean, what's pretty significant about this fire and location is if you saw the aerial shot, you could see how close the other houses were to this location. So if this fire really got going, it could have actually jumped to other properties right next to it. And it could have been a much more significant fire if it had gotten out of control. So the fact that the team here was able to have the proper training and resources to make sure that it was sustained into that location when only was about a 2-hour fire is extraordinary, because it could have easily, again, as the chief pointed out, the type of construction they were dealing with was very, very prone to escaping to a much bigger fire than it could have been. So they handled it just the way it should have been done, and the result was fairly minimal. It was tragic, of course, but and then the community kicked in to try and help people, and there was donations being brought left and right to folks, and the people that have been displaced by this have found temporary housing, and we're working on more permanent solutions for them. But the good news is that that building can be rebuilt, and it can be restored at some point. So I think kudos to the department and to everybody who participated in this process. It was really well done.
Do you evacuate the other homes, just in case that might happen, or no?
Yeah, a lot of times they'll come out and, yeah, we work with the
People
residents.
come out, they want to see what's going on.
Yeah, absolutely,
First of all,
yeah.
Yeah.
That one to the left, right now, they're in the process of putting in a fire alarm system. That's one of the 6 families. So I'm sure she woke up in the morning and says, I better pick up the pace and.
We had a near miss in that house, was it last
year.
summer?
Yeah.
Yeah, so that was just the one right next door. We had a fire outside that got into a porch, and luckily we were able to put it out before it got to be too big, so.
Presumably Chief Grace and his department was responsible for emptying out the contents of the basement?
And a few other state agencies as
Yeah.
well.
Yeah, okay.
Great job. Great job.
Thank you.
Absolutely.
Great job, gentlemen. Good job.
Thank you.
Thank you.
You got-
Thank you.
Thank you.
You even got a prize for doing the good work.
That's right.
Yes.
See what happens? We feed you when you come to see us, too.
Thank you. Have a
All right.
holiday.
Welcome, thank you, guys.
Happy holidays, guys. Thanks.
I know, we spend more time than we anticipated, but it's, you know.
No, it's a really good, it's a
yeah,
good story.
That
It's
was
a really good
important.
story.
People want to know, you know, and,
It's a really good story.
yeah, it is, it's tragic stuff, but it's good stuff to know. and things like that, for sure. All right, Bill, you're up. Yep, Town manager goals.
All right, well, thank you. Christina, you just gonna load it up?
Paul?
Paul? All right, I'm gonna take this off while I speak, but, okay. So, good evening, everyone, and thank you for this. I'm gonna try and, I know we're running a little bit behind time here tonight, so I'm gonna try and limit my comments to, there's a lot of slides, but I'm gonna really roll through those really quickly. I don't need to cover them all. But the good news is that at this point in time, last year, working through the goals and objectives, we were about 67% complete. This year, we're about 85% complete. So we've gotten pretty far ahead in this process of making sure that the projects that everybody has been working on is getting towards the final goal line. And I was pleased to see that we've incorporated the mindset into department heads, as you just witnessed, that department heads are picking up on the fact that the goals that the board sets for me are goals that we set with them, and that it becomes part of their basic and fundamental understanding of how they do their operations. So this is, I'm very pleased to see that they, and more departments are doing that now, so I'm really glad that they're incorporating that into their work. So the presentation guide is essentially this. There are 4 major goals which we'll roll through, and then the objectives is listed below that, and then and we'll give you the summaries of the. I think it would probably, if you just go to the summaries of each section, Christina, and it'll sort of give you an indication of where we are. So the first one is to protect and enhance financial health of the town. And then you'll see the various objectives underneath that. If you go right to the end, right to the final section there. Okay. You can see that we're at the point now where we're complete and it's ongoing on 4 out of the 6 sub-objectives for the protect and enhance the financial health of the town. Some of this is playing right into the budget process as we speak now. So there are 2 that remain in process, and we'll continue, and we're close to getting those completed as well. But one of the main thing was to make sure that we're changing the way we're doing with the budget, which we started last year, and really is becoming much more enhanced this year. We started the summit process earlier, as everybody wanted to do, We started that in September, October, so we're getting those words, getting those presentations out to everyone and making sure everybody hears the kind of issues that we're dealing with over the course of the year. And then preparing for what the next fiscal year budget will look like. All right, so next slide. So the next one is to protect and enhance communications and engagement. This is one where we are really actively involved in at this current time. So if you roll all the way to the end of that one, of protect and enhance communications and engagement, there are a total of how many? I believe there are 5, 6, and there are six sub-objectives on that category. Again, we're at 4 out of the 6 are actually complete and ongoing, and the remaining 2 are in the process right now. One of those is the actual communication strategy, which is close to being presented. We will present that to you in January, the first meeting in January. We should have that complete by then, and we'll talk about how we plan to implement that over the course of the next year. All right. Goal 3 is to protect and enhance financial health of the town. And that is, and then we'll go down to, and there are 4 subcategories there. And right now, we are every one of those is actually in the process of being completed. So we believe we'll be able to address almost all of them by the end of the review period. All right. And then the fourth major goal is protect and enhance town operations. And there are a total of, I believe there is, probably has the most subcategories. There are a total of, you can see, a total of 10 subcategories. Nearly 3 of them are actually complete and ongoing. There are 6 that are very close to being complete and ongoing, and the 4th is currently in process. The 10th is actually in process as we speak. So all in all, like I said, we're about 85% either nearly complete or complete at this point in time, which is significantly higher than we have been in previous years. Now, I will say that some of these goals are with ones that we've actually worked on in the previous review period, but there are several new ones, and they're enhanced each year as the board sets their goals for the town manager throughout the course of the process. So you can see, so 100% is actually, but 85% is actually in the completion phase. So I'm happy to take any questions at this point. I just I don't anticipate anything that's actually going to be problematic for us. I will say that I just got notification this evening from Chris Gallagher with respect to the rail and CSX goal was to try and complete the crossings, and also to work on the rail line itself. The rail line is really out of control. It's going to be something that's going to be handled by and the local commuter service is going to be handled by the MBTA. We are working with them. We're going to continue to work with them. Hopefully by once we get some clearance from the pandemic, that the train service will resume and the pilot process will resume. The main issue that affects Foxborough is the crossings, and we have 2 that are going to be worked on temporarily in the next few weeks, and then also, and those same 2 will be worked on for permanent crossings during the upcoming year. So there's going to be planned for Elm Street, and I believe it was not Baker, but is where the public safety building is on.
Chestnut.
On Chestnut rather, yeah, the Chestnut crossing. Those 2 will be worked on in the upcoming year. So we'll do temporary improvements to those, but the more permanent more permanent solutions will be done during the course of the next year. Questions?
I really only have one comment. I gotta be honest with you. It's kind of impressive seeing Chief Kelleher bring up those goals as part of his report. That your next level of leadership in the town is grasping the concepts of what we're looking for and incorporating them in their policies.
Well, so one of the things that we, so that the board will, I think I indicated to the board that once the board had set the goals for me, I was going to bring them to the department head level to say, okay, how do these incorporate into your work plans over the next year? And a lot of them immediately recognized that there were things that they needed to do right out of the gate. Some of them are a little bit more obscure than others, but there are clearly ones like, as the chief pointed out today in his presentation, and then, that which cross into public safety and then cross into finance. The finance department has been working on addressing a lot of those issues that we've talked about in terms of the budget and how information is provided to employees. The communication piece is something we're working on right in our office directly. And then also going to be deploying a lot of those responsibilities out to various department heads as part of our strategic plan. So the next piece of that too is capital and strategic planning, and that's something that they all participate in as well. And we're going to have more conversations about that in the upcoming, and I think next week we're having a meeting with the Capital Improvement Committee to talk about strategic planning. So it's something that it's become part of our culture here to work together on, because as I've stated on multiple occasions, we're only as good as the people that work with us, and if everybody works with us, we get to the common goal, and that is to provide the best service we can for the community.
Just if I could comment on that as well. 2 years ago, when the board first had dialogue with Bill about setting goals, and they came close doing it, I said I thought that was terrific, because really these are the town goals. They're not just the town manager goals. And as the chief policy board in town, you're taking the direction of what representing the people, saying this is what we want our town to do. This is the direction we want it to go in, and I think it's been working fantastic. As you mentioned. Doc and Bill really has, communicated with the department heads, and you see, this department, the fire department is one example, and there are many others where they're taking these and running with them, and enhancing their departments, their delivery of services, but then the overall mission of delivering public service to the town. It's been terrific, and so this now is the second year of really having a composite, holistic goal for the town, and it's really this year, in my opinion, has also worked out even better than this year. So continue to advance.
This goes to show how important it is that we get the direction from the board in this, and so you are all part of this whole team of making this work, and we take the direction from you, and ultimately it gets passed along. So there are a number of, one thing I'm going to be passing out to the department heads tomorrow is a set of unifying principles, which I think are really key to the organization and key to Foxborough itself. And the 7 principles are this: treat everyone with dignity and respect in every interaction. 2, select team members who strive for professional excellence in every responsibility. 3 is prepare for the future by developing and empowering leaders at every level. 4, prepare people before we promote them. 5 is seek continuous improvement personally and operationally. 6, make integrity matter most in every circumstance. And 7, remember that it is not just about now, it is not just about me, and it never is. So those are the underlying principles by which we try to build our organization around, and I think it's something that everybody here can see that. If you go into Mark Craig's operation, or Chief Kelleher's or Paige Duncan's operation, or or Chris Gallagher's operation, you see they're all grasping those same principles. We see it with hiring individuals. We want to make sure we have the right people that can fit the right slots and fill and who can follow these kinds of principles as we run our organization. So that's where we're at. I'm really glad. I'm really grateful for all the support I get from the department heads, from this board, and from Mike particularly, who's been working really hard behind the scenes to work on a lot of the collective bargaining pieces, which is really important as well, and also just operationally to make sure that everybody stays cohesively aligned with what we want to try and accomplish. Any questions?
No, I'm good.
No, I'm good. Is there anything?
Yeah, so this is, I think, what we had planned tonight was like the highest of high-level overviews, which is fine. When I looked through this document earlier, I felt like this could be a half-day conversation if we wanted it to
Yep.
be, right? Because there's so much here, so much important content, that I feel like and I've said this before about ownership, but I feel like in the position I'm in, I want to have some ownership of understanding this and driving it forward and moving some of this. And I think clearly there's a lot of great work here, and we're showing a ton of achievement and success because everything's pretty much on the right side of this, which means like really strong in process, almost done and complete. So that's great. So I'm just thinking about the future a little bit, and I'm thinking about some of these goals where I would look and say, I think that where it says in process or complete, you know, I still think there's opportunity. And of course, we all
Sure,
appreciate
yeah,
that there's
yeah.
a lot of opportunity. So for example, goal 1, objective F around provide new and better ways to connect with the community to our budget process for transparency, engagement, and fewer questions at town meeting. So when I think about that, and I think about some of the work that you said that Maria was working towards and George in their finance department, so that's probably in its very early stages, some of the work that they're doing. And so, you know, when I'm thinking about the goals and objectives and how we measure them and how we came to these scores, you know, I trust that this is all accurate and where it should be. I'm just thinking about, okay, we've achieved a lot here, and let's keep moving forward and think about, you know, continuing to develop those. So
The next generation.
next generation,
Yeah.
and like short-term, long-term, I think there's things we can do to continue to drive towards achievement on these goals. So I'm fine with a real quick high level tonight, and I want to continue to sort of dig into these things and
Sure.
continue to work towards.
But I couldn't agree more. I mean, I think that, you know, once these are established, it doesn't mean they're done.
Right,
It means it's a course of constant improvement, right?
right,
So we never stop once they're finished. It's a case of, okay, what's the next generation of change that we can look at? It doesn't mean, if you stay still, you know what happens. The world passes you by.
right.
So we don't want to do that. We want to continuously look at the processes that we have in place. And that's why I strongly encourage the department heads, the staff members to do better, more and better training, to constantly pay attention to what's going around, not only in our neighboring communities, but in the state and the country, to see, you know, what's the best way we can do things. So this is just sort of setting the base, the benchmarks and the baseline considerations for how we want to constantly move forward from there. The town really has not done that in a formal way up until the past few years. So I think this is setting those benchmarks for people to follow and to say, okay, we've come this far in this period of time.
Yep,
I think
that's
that's
great,
really
and I
good.
agree with that, Bill, and I just add that I want to understand and help drive the goals, and also this process, I want to understand the
Yeah.
process better, so I can understand it and feel comfortable that we're doing everything we can do to move things forward, so I appreciate
Well,
that.
Right.
that's a great observation, because I guess a lot of times we're never really going to be complete.
Right.
It's always.
It's exactly, it's
all,
continuous
you know,
motion. Yeah.
So to look at it now and see what, some of them are still in process, some of them look like they're complete, they're probably really not complete. You know,
Exactly.
not because of anybody's fault, other than they may just never
Just,
really be
it'll
complete.
constantly move forward.
So that was
Yeah.
great, that's a great
Right,
observation.
so complete in terms of a goal, which may be a short-term piece of a longer-term goal, so that's what we're doing here, I believe.
But we can't forget that this was better than last year. And last year's was better than the year before.
Right.
And 4 years ago, we didn't even really have a policy.
Yeah, a process, yeah.
A process like this.
Right.
So this is a work in progress and a living document that is always going to change.
Continuous evolution, no
Yeah.
question about it. Great.
Okay,
Thank you, Paul.
good, thanks, Bill.
Thank you.
All right. Okay, Mike, you're up, Assistant Town Manager's update.
Okay, great. I'd like to update the board and the community on a number of things. I'm very pleased to announce that we have hired a building commissioner. His name is Scott Shippey. He's coming to us from the town of Marion, where he's been the building commissioner, a designated CBO for the last 12 years. He'll be starting with us on January 24th, and we're excited to have him coming. He is in communication with our interim building commissioner, Paul DeBadgis, during that 5-week period. And, when we asked him when he could come, he said, I really want to give them 4 weeks, and 5 weeks would be better. And that's a sign of the kind of people we're looking for, that they're going to, if they're leaving a place, they're going to leave it better than they found it. So we're excited to see Scott coming. Next, the public health inspector. We had originally advertised this position as a deputy director of public health, and then went back, reevaluated it. We had a member of the Board of Health on our screening and interviewing committee, along with Deputy Chief Kenven and others. And through the process, we realized that what we really needed was a health inspector, not a deputy. And so we have hired somebody who we are very confident is going to become a deputy director here in Foxborough, but we're going to give him the opportunity to mentor under Matt Brennan and learn the skills of the trade and pick up some designations, some certifications along the way. So Cameron Shamey will be starting with us on January 3rd. He comes to us with a degree in a master's in public health, which was not a requirement of this position, but certainly is something that's very desirable. So Cameron has, since his degree work, he did some work in Worcester Department of Public Health through internship. And then, currently he's working as a case manager in South Shore Health in Weymouth. And we're excited to have him starting in early January. Next, I've talked about Dave Lalaberty retiring. We just had his retirement party over in the DPW garage. And it was a lot of fun. It was nice hearing, about his career. And we've just this week hired his replacement, an internal promotion, somebody with 30 years experience in Foxborough Tree and Park. So we're very happy to announce that Jim Caffin will be starting on January 3rd, so the Monday following Dave's retirement. Next, we have some openings that we're still working on. The fire department administrator, we're still working on that one after Nancy Bach's retirement. Water department, we had an administrator position advertised. We have hired Jessica Minton to fill that position, which opened another position in the water department. So we have currently the water department coordinator advertised. And then the library director position, I talked to you about that. I've been communicating quite a bit with the library trustees, as well as other professionals in the library world, just to to make sure we're on the right track with that. And so we have a good number of qualified applicants, and we'll be working on that very closely with the library board of trustees. And so another opening has just come up in the last 2 days, and that's a community caseworker at the Council on Aging and Human Services. And that's because Christina LaRose, who was mentioned earlier tonight, she's a social worker. She's been our community caseworker for, I'm not even sure, 4 or 5 years, done tremendous work. And, another town recognized that, and she was hired as the assistant director for the Council on Aging over in Franklin. Wish we could keep her, but, we wish her well. She's done fantastic work here, and we know she'll continue to do that over in Franklin. 2 van driver positions. One is a full-time van driver due to an internal candidate who actually applied to the part-time position. And so now that full-time position is open, and then also a substitute van driver. We still have that advertised. And the last couple are regionally grant-funded positions for the health department. And these are positions, these are full-time 40-hour positions that are going to be managed. They're advertised and managed through the town of Foxborough, funded 100% through grant, and I believe it's for the next 10 years. And this is a 6-town collaboration with basically our SEMRAC communities, Foxborough, Mansfield, Norton, and Easton, and also Plainville and Sharon were very interested in joining that collaboration as well. There are 2 positions. One is a food inspector, and the other is a housing inspector. So those are still advertised. As Bill alluded to, we're in the middle of contract negotiations, and in the past, we don't often get to the table until sometime in January, and we knew that it was going to be very important to get to the table with all our bargaining units early. So I was in communication with all of them in October, and we started negotiations in November, and we've had several meetings with all of the unions, and we'll be ready to meet in the coming months in executive session with the board to update you on that. And the last thing I'd like to just share with you is that there's been a lot of talk about the vaccination mandate, testing mandate that's come down to us from the federal government, from OSHA. And that's going to fall on us in come January, February. And so what happened was on November 4th, the OSHA Emergency Temporary Standard was issued by the U.S. Court of Appeal for the Sixth Circuit Court. That stay was lifted on December 17th, so just a few days ago. And so now we need to put into action the policies that we've been working on for some time now, along with our labor attorney. So there are 2 things. There's if we're going to do the mandatory vaccines for all of our employees, that will need to take effect by January 10th of 22, or the I guess a little more relaxed version, which is either vaccinated or tested every week, which needs to be implemented by February 9th. We have policies written for both of those options, as well as letters to notify all of our bargaining units, as well as our non-union employees, that this is coming out. The weekly testing is there's no requirement for the employer to pay for that testing. So our expectation is that employees that choose not to get vaccinated or are unable to get vaccinated for whatever reason and go out and get tested weekly, the expectation is that the employee will pay for that. That is a conversation that we do need to have with the unions, but I just wanted to update the board and the community, because they're hearing it on the news every day. This is coming into action, and we're prepared to move forward with that. And then,
Mike, what's our number, either number or percentage that, I know we have a pretty high percentage of employees that are vaccinated anyhow, but.
we do.
Yeah, what's the percentage that aren't?
So less than 10% are not. I would say it's probably about 8 or 9%. Now that's either the single Johnson & Johnson or the 2 of the other vaccine. And we are working rapidly on the booster to get everybody, fully vaccinated with that. So the fire department has held several booster clinics for employees, and I know they're gonna have more, and those are gonna also be opening up to the community. So, folks like myself who haven't been able to get to one of these clinics because of other work conflicts, are scrambling to get to CVS and other places like that, but that's what we're looking for, is for everybody to get fully vaccinated, including the booster. So that's where we are on that.
Thank you.
You're welcome. Any questions for me?
Thank you.
Nope. All right. Town managers report.
So, just to tie into what Mike had just said, I did issue a directive this afternoon that was consistent with the governor's direction today, as well as the Mass Department of Public Health, that we have a not a mask mandate, but a mass directive that tells people that, if you are in the building, and even if regardless of your vaccination status, you need to wear a mask indoors. That's why all of us are masked up tonight, and that's what we're going to follow. And so we're going to get that word out. We've gotten the word out to all the employees. We're now in the process of getting it out to all boards and committees as well. So that's the reason why we're doing that. The other couple things I wanted to update the board on. I just received a copy of a letter that was sent to Secretary Yellen today on behalf of Massachusetts communities from the entire congressional delegation, including Senators Markey and Senator Warren, that really define the issues that we're having with the ARPA funds, and that this was a really well put together letter, and obviously a lot of time was put into it, but there was a section here that was really defined, I think, by Foxborough, and was given to them to try and help them formulate this letter, which I do think they really well depicted the kind of concerns that we have as it relates to the offset that occurs when we received money from the Mass School Building Authority for the borough school. We actually received a lump sum payment, which they're viewing that from the regulations as they currently stand as an offset against the loss of revenues that the town took during the past year and a half. So that has been defined and is being asked of the Secretary Yellen's office to make sure that the final rules and regulations around opera are actually defined to provide us some leeway in terms of how we can address that. So I'm grateful to the congressional delegation, and particularly to Congressman Jake Auchincloss and his staff for putting that together for us and actually representing our interests in Washington D.C. directly on that point. A couple other things that I wanted to bring to your attention is that we actually this past week we had we were able to get everyone together for probably one of the last times we were able to get everybody together in a room safely was we did our annual breakfast for everyone and down at the Foxborough Country Club, and it was really well attended. Unfortunately, it was the same day as the fire, so the fire department couldn't attend, and the police could not as well. But some of them did. But we were able to at least salvage quite a bit of the food that was left and brought it to the fire department so they could all have it when they get out. And they came back, and they're all very grateful for that. So that worked out very well. So glad everybody could at least join their company and get together for the first time in 2 years to really have a nice event. So it worked out really well.
It was a good event. Appreciate it.
No, it was great. It worked out really well. And then let's see. So I do have I issued one permit this past week, and that was for the caroling on the Common, and that's for 12/22, and that which will be tomorrow night from 5 to 8 by the J.C.'s caroling on the Common. So that's and so they will be holding that event again from 5 to 8 p.m. on the town common. I just want to acknowledge the work that was done by Public Works and Facilities to get all the lighting in place and the work of the J.C.'s to help decorate the new light poles that have been in place and everybody's really enjoying the new lighting plan that's been put in place. And I can't say enough about the appreciation that we have for Schneider Electric for the grant that they gave us. And I do think when the opportunity presents itself, I think over the next few months, we'll be able to do a formal lighting of the common and recognize Schneider Electric for their contribution on their behalf.
And a couple of the businesses that lit up too, it's really pretty as you're entering, and.
Exactly, yeah.
Yeah.
You drive down Central Ave,
Yeah.
it's actually very well done.
Yeah.
It's nice to be able to see that carrying through now into the common, and that's the uptown businesses getting together and coordinating that effort. So thank you for them,
That's
their
great.
efforts on that as well. I do have a couple other comments I'll speak to relative to a couple of your action items tonight, and that's dealing with Valley Forge Road, which is supposed to be Valley Forge Way, and I'll explain that when we get there, but that's all I have for tonight. And I want to wish everybody in the community a happy and healthy holiday season. Hope that everybody enjoys the holidays with their families as much as they can, and everybody stays healthy during that period of time. And we'll see everybody after tonight's meeting on the other side of the new year in 22. Hard to believe we're going to be on 22 already. So,
Can I make
again-
one comment on the lighting on Central Street that you just spoke about, Bill? So, if you look at the businesses right along where Bill's Barbershop was, I mean, there's a new barbershop, there's the new Foxborough Nutrition, and businesses all the way up to the common, including Barrows Insurance. As folks take a drive up Central Street, take a look. Not only does it look beautiful, not only does it, light things up for the holiday as you approach a beautiful common, but also that has gotten quite a bit of discussion at the Foxborough Common Business Collaborative. One, because it's nice, but two, because we talk about having a walkable, uptown. We talk about thriving business. We're bringing restaurants there. As you go by there, take a look. I think that's what we're looking for, is not a mandated, hey, you have to do this, but, the business community and residential community coming together to further beautify our center, to make it a beautiful, walkable center of town. And I think, all boats rise in a rising tide, and that's one of those things that businesses will, thrive. And I think all of us who go around to eat or whatever, it's enjoyable. So take a look when you go down Central Street. It's beautiful.
Okay, let's see, so, Selectmen's update. New business, Doc, myself, and Leah went to the ribbon cutting of the Borough School today. It was, first of all, we're a Borough my family, we're a Borough family. My husband went to school at the Borough. My kids went there, and Michelle McCarthy is incredible. A lot of pride. You can see in a school when a principal really takes pride in the school, and it carries off. And to watch today, so I saw other borough parents some were on school committee that are off now. Some were PTO presidents, and so just to see even some of those people then to come, and Debbie, former superintendent Debbie Spinelli, who was there kind of at the beginning of this too. Michelle gave some of us a tour, very impressive. And if anybody is, in my opinion, if you have any question about where your tax dollars went on a project like that, go take a look. That is a state-of-the-art learning facility for sure. And I wish I can't remember the quote that gentleman said today about it. A school is just four walls, but I'm paraphrasing. But yeah, but your future comes out of the
Future is inside those four walls.
Future is inside those four walls, and it's it's true. And so. Anyhow, it was very impressive, and I'm sure if anybody at some point, obviously not when school is going on, but wants to go down and see the school, and, we probably have the Taylor coming up somewhere down the line, and I was just very, very, very impressed. A lot of hard work. That whole committee did a fabulous job. So, Doc, you have anything you'd like to add as far as?
No, just that it absolutely is a beautiful building. They did a wonderful job. Quick little shout out to Bill Yukna. What a great job he did on this project and certainly all the other projects
That he
we've
keeps his
had
hands
done
in,
over
yeah.
the last 15 years as chairman of the building committee. But yeah, Bill did a great job. Deb Spinelli, Dr. Spiritos, and all their staff and the school committee, both present and retired school committee members. That was a part of the process.
Yeah, and it was really nice because they had, some of the kids were outside, so they were part of the whole event, and they helped with the cutting of the ribbon, and afterwards, it looked like they cut pieces of the ribbon and gave each one of the kids a little piece of ribbon, so it was really cool. It really was. It was definitely an eye-opener of what that hard work turned out to be, because I hadn't been in the school myself, since the renovation was done, and it was very impressive. So if anybody is interested in that, I would definitely go take a look, especially, like I said, so, it's a lot of money invested, but the children are our future. So, yeah, definitely go take a look if you'd like to see the building. Quite impressive. Let's see, and we also have, under old business, CIP meeting is coming up this Tuesday, right? 20th is Tuesday?
Right.
5 p.m. here. And,
It will be televised as well.
yep. We had to move it because the school committee had a meeting
Right.
here, right? We supposed to,
So the purpose of that meeting is to sort of identify some of the big projects that we see on the horizon. As the chief was talking tonight, there was a fourth project which we didn't talk about,
I was gonna bring
which
that up,
really is
too.
something we should bring in, that is a substation, fleet fire substation, which has been talked about for a number of years. So that would be the fourth project of consideration that we've heard. And there may be others, but those are the four that I can think of, and we'll get into those discussions on Tuesday night.
okay. And we have a lot of action items.
Ready, Steph?
We are ready, Seth.
Motion to accept a $200 donation from Kathy Balagas to Veteran Services.
Second.
Any further discussion? All those in favor?
Aye.
Aye.
Motion to accept a $300 donation from Mary Ellen Duna to Boyden Library.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve all 2022 liquor, entertainment, common victualler, all auto, and automatic amusement arcade license renewals as presented.
Second.
Any discussion? All those in favor?
So we're, I looked through that list, and that's standard procedure where we're comfortable with that, right?
Yep. I think if anybody had an issue, we would be probably looking at that. It's just kind of standard, because they have to be done yearly.
Okay. Who pulled this together?
So Katie's
Okay.
did all the work, and there's
Hey,
210
Seth,
licenses.
this is my baby
Okay.
that I've been working on since the beginning of October. So it's, as Steph said, it's all renewals that were from 2021. Comparative to last year, we had 221 licenses. This year we have 210. So we have 8 of those 210. We have 18 Sunday entertainment licenses that I basically collect for the Commonwealth, send in their applications and their check. So that's actually not revenue that the town sees. And so I think we went over this last meeting, but Papagino's is turning in their beer and wine license for both locations. For 2022, Foxborough PD is aware of that, and all alcohol will be off premise by the 31st. Bapu G's, they're the kebab shop on Route 1. They're closing at the end of the year. They had a common vitular and entertainment license. Five Wits at Patriots Place, they are closed and not reopening. They had a common vitular and entertainment license. And then a Class 2 license, Charles River, they're closed. And then what we did this year was, and for the automatic amusement licenses, if you have 4 or more video games, that triggers an arcade license. So those 3 arcade licenses are kind of just looped into those automatic amusement. And then hopefully first and goal by all pro appearances, it's the Patriots tailgate team. They did not renew right now, but they're hoping to pull together their team for like August 2022 and renew that license just for entertainment at that time. So that makes up for the 11 that we lost from 2021.
So you're all over this. Got it. That's what I wanted to hear. Thank you. That's all the discussion.
It's a
Sorry
lot
for
of
too
work
much
and it's
info,
very
but we
tedious
also
work, and she
collected
does a terrific job with it.
All right, well, shout out to you, Katie, then.
$131,516. So
Sorry?
we collected $131,516 in revenue.
Yes. Oh, there it is. Yep.
Yeah.
Excellent. Great. Thanks for that update, Katie. Appreciate it.
And just for
Sure.
Seth and Steph's knowledge, up until a few years ago, we used to have to go in there and sign all 216
Oh, yeah.
licenses, which we do not have to do anymore because we finally approved a stamp.
Nice.
This, what you have in front of you is, it does not, it's hard to even say that that represents the amount of work that Katie has put into this. I mean, she's implemented a new software system, along with 2 other departments to do this. Coach and educate all of the different establishments that put in their licenses, even though it went automated and, accepted credit cards. She was also accepting a lot of checks at the window, although, the push was to go to credit card. And then, manually putting the stuff in, as well as teaching people how to do it for next year. It was an enormous task, on top of all of our other duties. So well done, nice job.
Good job, Katie.
I almost snuck by us without having a conversation. Imagine that.
I know, huh? Look at that, we get to give you kudos, too.
Yeah.
She's
All right.
at every meeting in the background in case you have questions on
Yep.
any of the stuff.
Yep. Take advantage.
So, all those in favor?
Aye.
Aye.
All right, this is a longer one. Motion to approve the extended hours request for Cowland Management Incorporated, doing business as Renaissance Hotel and Hilton Garden Inn at Patriot Place, to begin food and alcohol service at 10 a.m. on Sundays when the NFL is playing at Gillette Stadium, with a scheduled game time of 1 p.m. during the month of January 2022.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve the extended hours request for Better Food Foxborough LLC, doing business as Citizen Crust, to begin food and alcohol service at 10 a.m. on Sundays when the NFL is playing at Gillette Stadium, with a scheduled game time of 1 p.m. during the month of January 2022.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve the extended food and alcohol service hours request for CBS Scene DBA CBS Sporting Club to begin at 10 a.m. on all Sunday home games at Gillette in January 2022.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve the extended food and alcohol service hours request for Big Night Venues LLC DBA Scorpion Bar to begin at 10 a.m. on all Sunday home games at Gillette Stadium in January 2022.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve additional dates added to NPS LLC Magic of Lights temporary outdoor, temporary entertainment license to include December 27th, 2021 through January 1st, 2022.
Second.
Any discussion? All those in favor?
Right? Motion to adopt a change of street name from Valley Forge Road to Valley Forge Way.
So just by way of background on this,
Oh, Bill, I'm sorry, second for discussion.
I'm sorry about
Yep,
that.
second.
Apologies. Okay. So just by way of background on this, this was something which is really kind of an interesting thing. 1989, annual town meeting accepted the road as being Valley Forge Road. But in 2017, it was brought to my attention by a number of residents that that actually their deeds all reflected Valley Forge Way. All right, so we sent out a letter to all the people living on this particular road, and they all said that they would prefer to have it Valley Forge Way. So there's nobody that disagrees with this action on the street, but what happened was that I think we had a change in personnel in the offices, so we never got it onto the board's agenda to be formally changed. And I think what happened was that we weren't able to actually have the board formally vote it. It came up again because it actually did something that we need to do with SEMREC to formally change their documents as well to reflect that. So the board needs to take an action to formally accept it that way, because you're acting in this case as the Board of Road Commissioners.
When the sign says way, right?
It does
Well,
say-
it's funny because
yeah,
well, Bill Euchner lives on that street.
Right.
And also, I have another friend that lives there, and so, there's been multiple, credit cards, yeah. Christmas cards and different stuff, for many, many years, and when I read it, I was like, isn't it Valley Forge Way? Yeah.
The sign says Valley Forge Way. The
Yeah.
DPW actually changed the sign, but it needs, the board needs to form it, and the record needs to change it to vote it, so as the road commissioners to change it back to Way. Okay?
Where is it? I don't even know where that is.
Down right past
Right off
on
of
South Street.
Right off of South Street, yeah.
Okay.
Yeah, right before you get to the Taylor.
Oh, yeah.
All right, any other discussion? All those in favor?
Aye.
Aye.
Motion to approve the petition for the joint pole relocation on Rock Hill Street.
Second.
Any discussion? All those in favor?
Aye.
Aye.
Motion to approve the electronic communications and computer use policy as proposed and endorsed by the Personnel Board.
Second.
Any discussion? All those in favor? Aye.
Motion to approve the December 7th, 2021 Board of Selectmen meeting minutes.
Second.
Any discussion?
I don't think I read these. I'm not super concerned about them, frankly, but if you're concerned that I didn't read them, then I could go through it, but,
No.
No, they seem pretty,
They look
seem
good.
pretty good, yeah.
okay.
All right, all those in favor? Aye. All right, and the big one.
Motion to adjourn.
Second.
Under discussion, everybody, please, we won't see everybody till after the new year, so happy holidays, happy new year, and happy and safe, everybody be safe, so we can get into 2022.
Get your booster.
Let's get beyond this pandemic in '22.
You got it.
right?
All those in favor?
Aye.
Aye. Good night, everybody.
Happy holidays.